Hi, I'm Chrissy, and for my blog, I'm doing observation of shoulder examination. So the first things that you want to look at when they're coming off the field or into the AT room is their facial expressions and their posture. If they're guarding, sometimes if they're abducted and externally rotated, that can mean that they have a shoulder dislocation. So you want to look for certain things like that. Another big thing that you want to look for, obviously, is swelling and discoloration. So for anything that you're doing, though, you want to make sure you check bilaterally, comparing shoulder to shoulder. Another thing that you want to look for is just height of the shoulder. So there'd be like a drop off, or just comparing bilaterally to see if one's lower than the other. So you can also look for a step-off deformity at the AC joint. That's called the piano key sign, but you can still look for that in observation. You can kind of see it as well. Another thing you want to look for too is if the humeral head comes down into the armpit. That could be a sign of a dislocation. Then also some other things that you want to look for too is just feeling for the clavicle, making sure that if you're bringing it all the way out that it's equal compared to the opposite side, and palpating along the SC joint as well. Then another thing you want to look for too is any atrophy that they can have in any of the musculature, especially in their back, or traps and stuff too, and deltoids. And then the last thing you probably want to look for is winging scapula if you're moving on to the musculature, the scapula. So you just want to see if their scapula comes out over out into the back, which you can tell it could be a weakness in the serratus anterior muscle. So those are just some things that you want to look for just when you're observing, and then after you do your observation, you would just head into the special tests.